Hello, everyone. Welcome back. Today, we're going to be talking about another very important concept on pharmacokinetics, which is volume of distribution. So, what's volume of distribution? So, this is the volume that relates the amount of drug in the body to the plasma concentration. So, when we look at the formula, so it's going to be the amount of drug in the body, which is going to be in milligram, relative to the plasma concentration of that medication, which is milligram per liter. So, if you administer a medication, for instance, an intravenous medication, that medication, you're giving it directly into the intravascular space. So you are giving it into the plasma. So if that medication is only limited to the plasma, in other words, it doesn't go outside the plasma into the interstitial space or into other tissue. So we're going to say that medication has a very low volume of distribution because that medication is only limited to the plasma, because the plasma concentration will be high, and then because of that, that will decrease the volume of distribution. But for instance, if that medication moves from the plasma and is able to extend into the extracellular fluid or space, then we're going to say that medication has a medium volume of distribution. And if that medication moves into all the tissue, right, and is widely distributed in the tissue, then that means that medication, the plasma concentration of that medication is going to be low. And because the plasma concentration of that medication is low, we're going to say that medication has a what? High volume of distribution. And as we can see there, so this volume of distribution helps to understand how widely the drug distributes in the tissue. And high volume, if you have a medication that has a high volume of distribution, like I mentioned earlier, so that means that medication will be accumulating in the tissue because it's widely distributed into the tissue. And a dose medication is going to take a very long time to get those medication out of the system. So that means those medications are going to have a very long half-life. And when we look at medication with high volume of distribution, so those drugs, like we mentioned, they distribute widely. And these are mostly lipophilic drugs, guys. So mostly lipophilic drugs. So lipophilic drugs easily cross the cell membranes and partition into tissue, especially like fats or organs that have very high lipid content. And when you look at the plasma concentration of those drugs, they're going to be low relative to the amount of drug in the body or to the dose that you administer. And that's why patients with obesity, right, because of the adipose tissue, increased adipose tissue in those patients, they have increased volume of distribution for lipophilic drugs. And what are the examples of drug with high volume of distribution? So this include medication like digoxin, tricyclic antidepressants, chloroquine, amiodarone, and propofol. And moving on to the next one, which is low volume of distribution. So like we mentioned earlier, medication with low volume of distribution, those medications, they are limited to the plasma. And this is important for hydrophilic drugs. So with hydrophilic drugs, or drugs that are highly bound to plasma protein. So if you have drugs that are highly bound to plasma protein, those medications are going to be limited to the plasma. And then those medications are going to have a low volume of distribution. And when you look at plasma concentration of those medications, they're going to be what? High relative to the dose or relative to the medication in the body. And then if patient has pathology like edema, ascites, sepsis, because as we know, sepsis could increase capillary leakage, so it could cause post-venous capillary permeability. And this could lead to increase in volume of distribution for hydrophilic drugs. An example of drugs that has low volume of distribution includes medication like aminoglycoside like gentamicin, vancomycin, heparin, lithium, beta-lactam, antibiotics. And as you can see there, so with hemodialysis, right? So with hemodialysis, this will only remove drug from the plasma, which makes sense because when we're doing hemodialysis, which is a form of machine that we use, right, to remove toxin out of the blood. So the hemodialysis is going to be filtering the blood. So that means medication that has a low volume of distribution, that they are limited to the plasma. Those are the medications that will be very easy for the dialysis to remove from those patients. So that's why drugs that are highly lipophilic, strongly tissue bound, mean that they are widely distributed to all the tissue, or drugs that have very high volume of distribution, that medication is going to be very difficult to remove them with hemodialysis. As opposed to hydrophilic drugs, these drugs you can easily remove them by what? With dialysis, and they are mostly renally eliminated. So we've come to the end of today's lecture, guys. So let's do some questions together. So the first question there is a 70 kg patient who receives an intravenous bolus of drug X. Immediately after administration, the plasma concentration of that medication is 2 milligrams per liter. The dose administered is 140 milligram. What is the approximate volume of distribution of this drug? And like as we mentioned earlier, when we look at the formula for volume of distribution, it's going to be the amount of drug in the body, which is going to be in milligram, divided by the plasma drug concentration, which is going to be in milligram per liter. So from the question, the amount of drug in the body, which is the amount of drug that we administer, that's going to be 140, right? And the plasma concentration after administration is 2 milligram per liter. So when we divide this, they're going to be what? They're going to be 70. So that's going to give us 70 liter. So the best answer there will be what? Will be D. But what does this mean physiologically, right? So if we look at this patient, so this patient is 70 kg. So that means with 70 kg, 60% of this 70 kg is going to be this patient total body water. So when we calculate the total body water of this patient, it's going to be the 60% of this 70 kg. And when we look at 60% of this 70 kg, so that means this patient total body water will be approximately what? 42 liter. So that will be total body water for this patient. But look at this medication volume of distribution, 70 liter. So that means this medication is extensively distributed into all tissue in this patient. And this medication has a very high volume of distribution. So this is going to be a likely lipid soluble medication that is not conferred to the plasma. So this medication has a very low plasma concentration. So moving on to the next question. So a new drug is found to have a very high large volume of distribution. Which of the following property is most likely responsible for this finding? So medication with very large volume of distribution, so that medication is widely distributed into all the tissue. So most likely that medication has a what? High lipid solubility. And the last question there, a patient with severe arrhythmia is treated with digoxin. Despite therapeutic dosing, the patient develops toxicity. Digoxin is known to have a very large volume of distribution. Which of the following best explains why hemodialysis is ineffective in treating digoxin overdose? So like we mentioned earlier, digoxin is extensively distributed into the tissue. So because of that, the plasma concentration is going to be very low. And that will make dialysis very difficult to remove those, to clear those medications out of the body. Guys, we come to the end of today's lecture. Please don't forget to like, subscribe, and share this video with your friend. And I will see you guys in the next lecture.